Hello, Portland. I'm Dr. Trevor Haynes. I'm a podiatrist here with Elite Foot and Ankle Associates in the Portland, Oregon area. Today, we'd like to talk to you a little bit about minimally invasive surgery, or what's commonly known as MIS. Minimally invasive surgery has been practiced throughout the United States and the world for decades. It's a proven surgical procedure for correcting things like bunions, hammer toes, Morton's neuromas, ball of foot pain or metatarsalgia, plantar fasciitis, heel pain. It's even used a lot to help diabetics with ulcers and to offload those bony prominences. So a lot of questions that I get is, or one of the questions that I get is, how is MIS different from traditional surgery? Number one, it involves very small 2 to 3 millimeter incisions. These typically require only one stitch and sometimes even no stitches right after surgery. Number two, we do not use hardware. There are a lot of doctors out there performing what they call minimally invasive surgery using screws and hardware. True minimally invasive surgery does not require hardware. This is a common misconception. When patients come into my office, they can show up on time at their surgery time, and they can walk out right after surgery. There's no tests, there's no COVID tests, and there's no post-op recovery time. Another common question that I get is, what are the advantages with minimally invasive versus traditional surgery? So number one, there's a huge financial advantage. We're taking the hospitals out of the equation. So there's no facility fees, there's no anesthesia fees. It's just straight up my fee for the surgery. Number two, faster recovery. Now your bone's going to heal at the same rate whether you get screws or not. But faster recovery in the fact that there's less post-operative pain. Your incisions heal faster because they're much smaller. Number three, you can walk immediately. Again, you walk in for the surgery and you walk out right after surgery. You may get a boot, you may get a post-op shoe, but ultimately you walk out right after surgery. Number four, no systemic anesthesia. Again, these are done in the office under local anesthesia. There's no sedation, there's no general anesthesia, which will again allow zero post-op recovery time in the clinic. Once the surgery is over and you get bandaged up, you're placed in your boot or your post-op shoe and you're walking out the door. Number five, no scar. Because these incisions are 2 to 3 millimeters in length, typically there's no scar, or if there is one, it's very, it's hidden and it's not even noticeable. And because of these small incisions, there's less infection rates and less healing complications or wound healing complications. That's what makes this surgery great for diabetics. Diabetics are known to have wound healing complications. So these surgeries can really benefit them and help offload areas where they might be having ulcers or calluses, which can ultimately lead to amputations. So if you've been told by your doctor, if you've been told by other physicians that you're not a candidate for surgery for such things as you're on a blood thinner, you're a diabetic, you're too old where the risks are outweigh the benefits, I urge you to give us a call here at Elite Foot and Ankle Associates. Our phone number here is 503-668-5210, or you can visit us at our website at elitefaor.com. And remember, here at Elite, we are the only podiatrists in the Portland, Oregon area practicing true, no hardware, minimally invasive surgery. So give us a call and we'll get you checked out and hopefully get you feeling pain-free and back on your feet. Thank you.